I'm bringing you a very, very short message, which is a public health alert that CDC, WHO have noticed that in the last few months since the COVID-19 outbreak, children are presenting with what is called a Kawasaki-like illness. Just very briefly, what is Kawasaki disease? First reported in 1961, a physician in Japan had noticed children presenting with five main things. Five things, or at least five, a mnemonic of fives. Children were less than 5 years old. They had fever of more than 5 days. They had 5 clinical symptoms. Don't forget, red eyes, beefy red tongue that looks like a strawberry, lymph node involvement, hands and palms and soles of the feet that look red with swollen hands and feet, as well as a red rash. Reports in the US, Britain, New York, France, Italy about a Kawasaki-like disease. Now here is the relevance. We always knew Kawasaki symptoms: rash on the feet and hands, specifically the palms and soles, and then a rash. Here's what's even more concerning about this illness. What was Kawasaki syndrome doing to the heart? This is the big artery, or the aorta, that leaves the heart, and these are 3 big vessels from the heart. The blue are veins. Now, around the heart, from the aorta leaves 2 vessels and circle around the heart and supply the heart. So these orange things are supposed to represent normal coronary arteries. What Kawasaki syndrome did, which was more dangerous, was that it did 3 things. The whole heart muscle got inflamed, and so that's why I've used this pink to illustrate it. Heart muscles got inflamed. Secondly, children will develop what is called aneurysms, so that instead of the normal vessel that is nice and smooth, they develop these little bulbs along the vessels that were all inflamed. Remember, Kawasaki-like disease. Now here is the relevance. We always knew Kawasaki symptoms and syndrome represented some infection, but there was never anything to connect it to an infection. For the first time in history, we know that there's a connection with COVID-19, and so maybe there's a common pathway that links all the prior infections with this syndrome. It doesn't mean that all along it's been COVID-19, but it clearly makes it interesting. What does this mean? If you're a physician taking care of any patient with COVID-19, remember to look out for children presenting with Kawasaki-like symptoms. Also, if you're a parent, look out for these things. The CDC classification is not just a mild illness. This is what they said. Any child below 21 presenting with a fever and requiring hospitalization plus increased inflammatory markers and any involvement of 2 organ systems. The 2 organ systems could be the heart, lungs, hematological abnormality, neurological disorders, or any of the issues that we know have to do with Kawasaki disease. In addition, inflammatory markers: C-reactive protein, low albumin, bandemia, D-dimer, ferritin, fibrinogen, elevated SED rates, LDH, interleukin 6. If any of these are happening, or you measure any of these, it could be suggestive. Finally, you ought to make sure that there's no other reason that would explain the patient's Kawasaki-like disease, like toxic shock syndrome or staph infection. And then lastly, at this point, the thought is that if you see any child die from COVID-19, you have to assume is this syndrome called multisystemic inflammatory in children. Thank you.